approach is a neurodevelopmental one. This means that we consider the course of an individual's development in order to identify possible causes for later learning difficulties. This is why we pay careful attention to the reflexes that are either present or absent in a child, because they may point to delays in the development of the central nervous system. If a child has reflexes present that should have disappeared very early on in childhood, the chances are that he may not have the equipment needed for school success. In this case, we say that he or she simply isn't learning ready. Now, there are over 70 known reflexes that we would call primary reflexes. Those that you are probably familiar with would include the sucking and the swallowing reflexes that are so important for early survival. Also the grasping reflexes that all babies show. The reflex system originates in the cerebellum and can be observed as early as 6 weeks after conception. Now, each reflex has a particular job to do and a typical length of time in which to do it. So if primary reflexes are present past their time, they can cause many problems that later impact on learning. Included but not limited to these are poor eye functioning, weak gross and weak fine motor skills, emotional immaturity, and appearing in their own time are the postural or secondary reflexes which we keep throughout our lives and which are significant for both our physical and mental abilities.